Okay. We'll discuss strategies for managing patient care equipment, which is one of our responsibilities, believe it or not. Not just reusable medical instruments. We take care of a lot of equipment in sterile processing because it is the only location equipped with maintaining, cleaning of medical equipment. Not always the storage part of it because we get to store instruments on different user department locations, but we are the only department equipped enough to actually clean and meet the demand for cleaning purposes for many medical devices. We explain the importance of communication and coordination as it relates to ancillary support. While the operating room is the central service department largest customer, we supply other departments as well. As you guys know, we supply labor and delivery. We emergency department with packs and trays. We support the cath lab and also X-ray as well. And if we have associated or affiliated clinics that's attached to the hospital, we help them with devices and supplies as well. So we provide service to diverse departments and ensuring they have the items needed. Providing services to all of these people can be a little bit challenging if it's not structured properly. So this chapter focuses on common support services provided by SP technicians. Identifying the SPD's role. The level of service provided by the sterile processing department varies by healthcare facility. Like I said earlier in the chapter, it depends on where you work. If you work at a facility, especially because when I used to travel as a contractor, I used to work at the VA hospital, and our role as technicians or the hospital was just instrumentation. We didn't pick supplies. If we were to pick instruments or we're preparing our pick sheet for a procedure, we were only responsible to pick instrument trays. The material management department was responsible to pick supplies. It was done separately. They would take the supplies to those rooms that are needed. So that's what we did as technicians. Regardless of what you do, the policies and procedures are still the same no matter where you work. If you provide just instrumentation, the way you transport instrumentation is the same as you will if you're in a hospital that does both of them. Right? Most hospitals I've worked in, when you're doing cases, you pick supplies and instrument. The VA in Atlanta was the only hospital that I worked in that had two separate departments taking care of surgical instruments and supply at two different times. All right. So it's sterile processing department that does the latter should have the system developed that meets the needs of all patients and provider. If you only send out supplies like your operating room packs, like syringes and stuff to departments, it should be done in a way just as you would if you're supplying both items like reusable devices and stuff like that. Patient care equipment. I've heard about pain pump. I've a lot of heard about pain carts and equipment that are used to move around and help patient care. Along with instruments and supplies, technicians manage a large portion of healthcare facility patient care equipment tasks that includes assembly, delivery, tracking, retrieval, decontamination, and storage. Delivery is sometimes split up between technicians or transport courier that the hospital hires to transport these equipment back and forth from sterile processing. But if they have to be responsible for transporting instruments back and forth from sterile processing, they have to be certified into doing that or trained on how to handle patient care equipment. Patient care equipment must be readily available when needed, just as you will be ready for your sterile instruments before they make it to the operating room. This requires that it be safe, functional, and ready to use and free from soil and contaminants. You have to remember that we cannot sterilize patient care equipment. So these just need to be decontaminated and clean and safe to handle for use. An effective patient care equipment management program is essential for managing these costs. Equipment that has not been properly cleaned poses an infection threat to patients and healthcare workers who will handle these instruments down the hallway and serve as maybe patient zero for contamination and infecting other people. That threat is magnified because the equipment may be handled by several workers along the way and used on several patients if they're not properly cleaned. If it's not properly assembled and ready for use, there may be a delay in the treatment of the patient. Delay may occur if time must obtain necessary components such as tubing, collection devices, and pads. So if you just clean the instrument, that's one thing. But some instruments require certain supplies that go along with it to make them easy to use. And if they're not provided, it makes it more difficult for the user department to actually get them to use for the patient because why? They have to go for the supplies, they have to go for gauze sponges, they have to go for bandages that will be used to, do this. So when you clean and assemble your medical equipment, you have to make sure to follow manufacturer instructions for cleaning procedures of your medical equipment, because everything you learn about medical equipment comes from the manufacturer instruction, the needed supplies that go along with these equipment to be in a ready-to-use state, how to store them. Do they require further charging of these medical devices? Does it have a battery that needs to be recharged and can be used like peen pumps? Medication dispensing devices that needs to stay active just in case there's a power outage. So there are basic types of patient care equipment. Understanding the purpose of basic types of patient care equipment can improve customer service if you know what they need. So figure 20.1 identifies and defines some of these equipment that are typically handled by sterile processing professionals. Take a look at figure 20.1 in your book and see the different examples of these devices. Technician must also understand requirements for cleaning. Where do we go about getting the requirement for cleaning for any equipment whatsoever in sterile processing?
User instructions, manufacturer's instructions.
Manufacturer instructions, where we get all our cleaning instructions from manufacturer instruction. We get the storage instruction from manufacturer instruction. The supplies needed to go along with this cleaning equipment, we get them from manufacturer instruction. Each step in the patient care equipment process is an important component of a comprehensive patient care equipment program that needs to be established and continued and improved by the hospital or medical facility that you find yourself in. We cannot go about start making up stuff on our own. We need to follow manufacturer instructions and policies and procedures put in place, because these policies and procedures protect us from harm and protect the patient from harm and keeping everyone safe and providing timely treatment or care for patient in a hospital. Closer look at responsibilities. So we got SPD technicians. When we look at responsibilities when it comes to patient care equipment, we got SPD technicians, we got biomedical technicians. So in the sterile processing department, we maintain the flow of patient care equipment system. That's our job because we're the only one equipped. We also partner with biomedical engineers who are there to either troubleshoot, do preventative maintenance, and sometimes repair instruments or equipment that are malfunctioning or faulty. Technicians in biomed perform safety inspection on the purchase of brand new instruments to make sure they're safe for handling. They can function within the facility. They are especially trained to inspect, test, and repair patient care equipment. That's their job. You, as an SPD technician, should not attempt to perform equipment testing. That is not your job, unless maybe you came from a biomedical field, you're certified, then you can use that certification. But unless you're trained to do testing of medical equipment, then you can go ahead, but you have to play your role as a technician. Same goes to a biomedical technician. His job is not to clean medical instruments or equipment. He hasn't been trained to do that unless he's certified as a sterile processing technician. Yes, he can go in about to clean patient care equipment. If you can do that, you can actually be trained to do the cleaning and inspecting part if and only if you're certified to do so. Biomedical technician must also not clean equipment used for technicians. When equipment enters a healthcare facility, it must be safety checked and tested by the biomedical technician before they're dispensed for use. Brand new instruments have to have a sticker and preventative maintenance sticker placed on it to be used for patient care in the future. These items must also receive periodic follow-up inspection scheduled according to the equipment manufacturer. Usually the manufacturer will have a periodic check-up letting you know when it should be checked, what components should be changed on that device. So that will be done by a biomedical technician. We have to pay attention to the PM stickers. So there are stickers that put preventative maintenance stickers on the equipment that tells you that the next appointment for preventative maintenance is June 2026. And then you see that when it comes close to June, you need to make sure that you get out there and get the preventative maintenance care taken off. So the Joint Commission requires that the preventative maintenance standards be established for healthcare equipment. The following information should be recorded and maintained for each piece of patient care equipment when a preventative check is done. You should have the assigned equipment location. Where is this? Is it an X-ray machine? Where is it assigned? Is it in labor and delivery? The ownership, is it loan? Is it consigned? Is it rented or leased? Scheduled pickup or preventative maintenance. We should have a date stamp on it. When is it going to be scheduled for preventative maintenance? We need to know what time. The facility defined PM standards should be also attached or hanging on that device as well. So we need to know the standard just in case an agency like the Joint Commission comes in for observation. They need to know that you need to read that and find out what it does. Repair history. How often were they repaired? What happened? Why was it repaired? Okay, so all of the information that is needed should be attached to that equipment. Handling used or soiled patient care equipment. All patient care equipment used must be considered contaminated and handled as such, regardless of their appearance. It can look brand spanking new and clean. You cannot see MRSA with your naked eye. If it was exposed to a patient that had MRSA, you cannot see that. So everything should be handled with standard precaution. All right. The assumption that it's highly infectious and contagious as well. Technicians make routine schedule rounds to pick up soil equipment from user department, or it might be assigned to a transport person who has been trained to transport equipment, or